Hi, I'm Alexandra, and I have Crohn's disease. This is my Betterpath Health Bio, a summary of my history with Crohn's based on my actual medical records. This summary page gives me and anyone treating me a big picture understanding of what's happened since diagnosis. We have some information about that diagnosis up here, some surgery and hospitalization details. We also have an overview of my treatment history, as well as an overview of procedures that I've had done related to IBD. So if we want some more details on any of these facts, all we gotta do is click. So we can see there was a lot going on during this surgery here, but how do we know that this information is totally legit? Because it comes from the actual records. There it is. Let's find the path report right here. So all those facts over here, all found right here. Very cool. Received fresh is an open portion of ileum. Wow, that is graphic and kind of awesome. Wish I could have gotten a souvenir. All right, moving on to treatments. I have a little alert thing happening here. What does that mean? Oh, that means I need a liver function test. That is true. I'm going to get on that now. So all of these little dots here represent a treatment-related fact found in my actual records, and these facts are used to build a timeline of my medication history. This is really handy because I would prefer to not relive my prednisone experience. Not a good time. Moving on to hospitalizations. Now, I trust my memory for some Crohn's-related stuff, but hospitalizations are not one of them. Because if I'm hospitalized, I'm either in a lot of pain or I'm doped up on morphine. But either way, my brain is not to be trusted, okay? My health bios breakdown is way more reliable. On the left here, we have why I went in. Did you know that was a technical term for vomiting? Emesis? I don't know. Very fancy. In the middle, we have what happened while I was there. And on the right, we have what we learned from the experience. We learned a lot in this case. A lot was noted. And similarly with medications, on the left, we have what I went in with. In the center, what was administered while I was there. There's those fun painkillers we were talking about. And at the bottom, we have the documentation, the records that backs all of the above up. And the last thing I want to show you really quickly is just a list of procedures. This is where we see the results of all of those x-rays and colonoscopies and stuff. And you'll notice that my latest colonoscopy is no active disease. That's super exciting, but it doesn't mean that I don't have symptoms. And, while I'm lucky enough to be in remission, this disease still impacts our lives every day, even when we're stable. So that's why Betterpath is also building ways for me to capture things my medical records can't, like how I'm doing day to day. Stuff like diet and sleep and exercise, all those things that we don't really know how big of an impact they have. The goal here is to make connections between what I do and how I feel. And all of these features are coming in the health bio as well. So what you're seeing now is mostly clinical, but what you will see will be totally comprehensive and a lot more holistic. Really exciting. So that's the Betterpath Health Bio. Super useful, it's free, and there's lots of exciting things to come. Sign up for yours now at betterpath.com and stay tuned.